All right, it's Tuesday morning, and joining us live, as he does almost every Tuesday morning at this time, is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, good to see you again this week. Of course, we've spoken a few times recently about the measles outbreak in southwestern Ontario. It keeps expanding. Public health officials are warning the public about the dangers. But my question really is this, and I don't even know if you have the answer, but when will it end? How will it end? I mean, with current protocols in place, effectively none, can you really stop this, or are non-vaccinated people really just kind of vulnerable to this?
That's the sad reality. This is a very, very transmissible infection. And if people aren't immune to this virus and they're exposed, they're going to get infected. It's that transmissible. It's that contagious. We have so many cases of measles globally now. There's a big global resurgence, and we have basically unprecedented human connectivity. We travel, and people travel to Canada. Canadians travel abroad. If someone's non-immune, it's kind of a matter of time before they're going to get exposed, sooner or later. And sadly, it looks like it's on the sooner end of the spectrum because of this. We're seeing these outbreaks now, not just in Canada, but in Texas. And of course, within Canada, we were seeing it in Ontario. You saw it in Quebec. We had another one in New Brunswick. I mean, if you look at Ontario cases in 2024, we already exceed the number of cases that there were if you look at the number of cases in Ontario this year, 2025, we already exceed the number of cases that we had all of last year. So it's a problem. Obviously, it's a big issue to build back public trust in public health, to ensure people receive vaccines when they're offered to them. It's a big deal to lower barriers to vaccinations so that people, take these vaccines when they're available. But it's a battle worth fighting.
Yeah, and we've still got, 300 days to go in the year. So, yeah, that's definitely concerning, Dr. Bogoch. In the meantime, another concerning story coming out of the DRC in Africa, where some 50 people have died from a mysterious illness. Doctors are baffled. I'm sure this is on your radar, Dr. Bogoch. What are you hearing about this, and what should we be thinking about here in North America?
Yeah, I mean, fortunately, obviously this is tragic. Fortunately, it looks like it's a very localized phenomenon, and the WHO has really been supporting the DRC in this area. There's been 53 deaths reported to date. It's interesting in that, they don't have an answer yet. Most of them have been in young men, and it's very clustered. I think the issue here is, and the preliminary hypothesis is that this might be a bacterial meningitis, or some form of chemical ingestion or toxin ingestion. At least that's what the WHO is saying based on their preliminary investigations. Obviously it's tragic. Fortunately, it does seem to be dissipating in recent weeks. So the rate of illness has gone down. And they have taken samples to a large, well-known, highly functional public health laboratory. They've ruled out things like Ebola virus and Marburg virus. So investigation is still going, but it does look like it's petering out. And hopefully it stays localized and is quelled quickly. Yeah,
let's hope so. Okay, we've got a minute here to talk about March break next week, Dr. Bogoch. Lots of nasty illnesses going around, people in Mexico. We've covered this fairly extensively recently. What's your best advice with anyone with plans to head to a sunny Caribbean destination in the next week to 10 days or so?
Oh, for sure. Have the best time. I know it's freezing and snowy in most of Canada, and what a wonderful opportunity to get away. It's always a good idea to talk to a healthcare provider before you travel. There might be tips that can keep you healthy while you're away. Some people might be traveling to areas where there's malaria, in which case malaria prophylaxis tablets are extremely helpful. And remember, malaria can be a very dangerous infection. There's other mosquito-transmitted illnesses almost everywhere, and just little tips to how to avoid getting bit by mosquitoes, using appropriate insect repellents and timing the use of those is helpful. And then lastly, I mean, gastrointestinal illnesses reign supreme when we're traveling to many parts of the world. And there's sort of this old adage, boil it, cook it, peel it, or forget it. Because some of the hygiene and sanitation is a bit different. And if you want to reduce the risk of a gastrointestinal illness, that's the best thing to adhere to.
Yeah, nobody wants that while they're away, that's for sure. That is Dr. Isaac Bogoch, as always, joining us. We appreciate the time, Dr. Bogoch. We'll see you soon.